Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Phyllis Wojtusik. She's Executive VP of Value-Based Care at Real-Time Medical Systems. Welcome, Phyllis.
Hi, John. Thanks for having me. I'm happy to be here.
Yeah, excited to dive into today's topic. Lots of changes happening, in real time, it feels like in healthcare right now. So I'm excited to learn from you. But before we go there, tell us a little bit about yourself and real-time medical systems.
Sure. I'm a nurse. I've worked in acute care, post-acute care, physician practice. So I have a wide range of experience and a lot of different views on healthcare based on that experience. Real Time is a post-acute analytics platform that looks for interventional moments. So managing and watching that post-acute patient in the skilled nursing facility, looking at their clinical data, mining that, and surfacing things that might impact the patient's stay during that time. We call that an interventional moment where you can intervene, prevent a poor outcome from happening. And so it's really exciting use of technology, and it really helps nursing staff manage and monitor the patients.
Awesome. Well, it's one of the coolest things what you guys are doing, this whole predictive modeling and using data to really understand and kind of intervene early is such a cool area. But tell me, how can post-acute care providers collaborate with hospitals and ACOs to really improve care coordination and reduce complications in line with the CMS transforming episode accountability model, also called TEAM? How can they work together that way?
Yeah, so it's really important that everybody is kind of pulling in the same direction. So using that live data that I just spoke about to manage the care of the patient through that post-acute SNF episode and tie it back to the primary care doc. So if you think about TEAM and what it's trying to accomplish, so it's the newest value-based care model that's out there. It's really trying to get that patient through the continuum and back to their primary care doctor. So if a SNF is managing part of that piece, they have to really be in lockstep with that hospital stay. And TEAM identifies 5 or 6 surgical diagnoses, right, that a hospital needs to coordinate care with. So looking at those specific clinical groups, working with that health system to identify what a typical pathway looks like for each one of those clinical case types, and then working on those transitions of care. So from the health system to that SNF, making sure that's a smooth process, because we all know that when a transition happens for a patient, they're more likely to get readmitted. So making that a smooth process. And then on the output side from the skilled nursing facility, making sure that smooth process exists to go back to that primary care doctor in the community. So I think that's the overall piece. The real crux of this is sharing data at the patient level so that we're all on the same page. We know what's happening with that patient and being transparent in that care back to that health system and that primary care doctor.
Yeah, so tell me more about the role of post-acute care facilities in supporting the hospital and ACO's efforts to smooth the transition that you just talked about from acute care to primary care, and what's being mandated by this team model.
Yeah, so part of the model speaks about care coordination, and that really has to do with not only care in the facility, but those transitions, making sure that the people who are managing the care, not only the nurse at the facility, but the nurse at the primary care doctor's office, the nurse from the hospital, all have that same kind of view of what's happening with that patient. So they all understand where the patient is in that pathway to getting better. And so the other piece that the post-acute facility plays a really critical role because the patient's at such a vulnerable stage. So they've been through that acute stay, right? They've had whatever surgery they're going to have, but now they're trying to recover. So I don't know if you've ever been in the hospital or not, but when you're sick and in the hospital, you really don't remember a lot about what goes on. It's all kind of a blur. So in that post-acute facility, the patient is starting to get better, absorb more of what's going on, understand what they need to do. So education during their post-acute stay is really important for that patient to continue their progress as they move along the continuum. So I would say, making sure that the post-acute facility manages their care, right? Whether it's a surgical incision or they have chronic comorbid conditions, making sure that they don't go back to the hospital for an infection or anything like that. But then doing that education that will help that patient progress back to the primary care and back into the community. I think that's a really important piece that often goes underlooked.
Yeah. I mean, you've highlighted two important things, the data and sharing the data where it needs to be, and then also the education piece. I think both of those are really valuable. And we've seen a big emphasis on reducing hospital readmissions. Everyone knows that number, right? We're getting paid for
Yeah.
it, right? We follow the money, as we say. But how can post-acute care facilities partner with the hospitals and ACOs to really help optimize the recovery and also to ensure high quality, cost-effective outcomes for those patients and avoid those readmissions?
Yeah, there's really a lot. So if you are really partnering with that health system, there's probably a plan of care that you could agree on for that specific diagnosis. And so making sure that during their post-acute stay, they hit those key milestones that are identified from the health system about how that patient progresses. So understanding there's a standardized pathway, if you will, a clinical pathway that the patient should follow. And John, one of the most important things that we can do is standardize care. We know when we standardize care, we get better outcomes. So really understanding that case type, working with the health system to standardize that care, really helps drive those outcomes and prevent those readmissions. But the other thing that the facility or the skilled nursing facility really needs to focus on, are there any subtle changes in condition for that patient? So let's say the patient had whatever surgery they had, back surgery, hip replacement, whatever that is. And they have other chronic comorbid conditions like congestive heart failure, where people's lungs fill up with fluid because their heart doesn't pump as well. And so you have to be monitoring that patient for not only how their incision is doing and how they're walking, but are they having an episode of congestive heart failure? Because if they are, that can drive them back to the hospital. So managing those comorbid conditions, and the way you can do that is get clinical insights from that analytic piece that we talked about. So mining that data, looking for changes that might suggest the patient is gaining some weight, having some edema in their feet or ankles, and maybe their pulse ox or their oxygen saturation is dropping a little bit. So identifying those key things that would drive somebody back to the hospital and managing them at the facility level is really key to preventing those readmissions.
Interesting. Yeah, I mean, I think you're highlighting some really important points, as far as the partnership. I think it's funny that it's called team, right? It's teamwork between
Yeah.
organizations that many times, knew each other by fax, I would describe it, sadly. But are there other specific strategies that post-acute providers can implement to support hospitals in being able to utilize real-time data, predictive analytics, for better decision making and improved outcomes under the team model?
Yeah, so I think you make a good point about team. They actually have to talk, right? So you mentioned a fax. What happens when a patient gets discharged? All the information gets faxed. You get a big chunk of paper coming through. That's not efficient or effective. So one, in that transition, we usually suggest that you have a warm handoff, a nurse to nurse handoff, where the nurse caring for the patient at the hospital talks to the nurse who's going to care for the patient at the facility, gives them key nuggets of information. Yes, I can see what their med orders are and things like that, but there might be something that's important for that nurse to know about that particular patient that will drive their care forward or backward, depending on what the item is. So that warm handoff, that's one of the strategies I've seen utilized in many, many networks across the United States. So that's definitely important. But I think that using the data that we talked about, getting those key insights and working with the SNF facility with the hospital on how are you going to manage. So I talked about that CHF patient. Well, maybe the patient needs a chest x-ray to see if there's any fluid in their lungs. And it's hard for them to get an x-ray, right? So maybe the hospital and the facility work together on mobile x-ray or mobile labs or things that support the patient and the care at that facility. Now, most facilities get those types of things, but there may be an area where they aren't able to supply that and they have to rely on their hospital partner to work together to supply those needs. Sometimes it's equipment needs. And so making sure that what might be needed for the patient in that facility is there and partnering with your hospital to address those things up front before the patient gets there is a really good strategy. So it's that talking, that teamwork, that working together. I also think that understanding the other chronic conditions that the patient is affected by and having a plan of care for them from the hospital and the primary care doctor to the SNF. Hey, here's how we're managing Mr. Jones's X. And so making sure that's understood from a clinical perspective and taking over that care and managing that, I think is really, really important. Then if we talk above the patient level, it's really important to look at outcomes overall as a population. So let's talk from the SNF in the hospital. We sent you 15 patients that had knee surgery or hip surgery. Here's how they all did. And we saw that 3 of them, were delayed in their therapy because they had nausea or vomiting or whatever. Is there something we could do on the health system side to prevent that from happening? Maybe it's stopping a narcotic sooner or using a different pain med or something like that. So really understanding that both sides of the equation relate to the outcomes, no matter when the outcomes happen, if you will. So looking back at the population, understanding what happened, and then making a plan to adjust for that population as you go forward. So it's really trying to be collaborative in that care management space that I think makes a real difference on those outcomes along with that data.
Yeah, absolutely. I think another interesting area is that, the team model has some health equity goals that are outlined as part of it. How can post-acute healthcare organizations help hospital and ACOs meet those goals, and particularly, assisting the underserved populations and aligning with the value-based care principles out there?
Yeah. So it's really interesting. In the last new MDS, the minimum data set that facilities have to fill out, there finally are real social determinants of health on there. So now those social determinants are starting to be collected, food insecurity, housing insecurity, things like transportation, all of those things. So now they're starting to collect data. And it might be that the hospital had one view of what's really happening for that patient, but the facility has a different view of what's really happening for that patient. So being able to, again, this is a partnership between the health system and the facility to complete a full view and understand what the patient might need. So when a patient's preparing for discharge, what happens? We make appointments, we say, here, pick up this equipment, pick up your meds, all that kind of stuff. Taking a little bit different approach and starting to work with outside outpatient services. So maybe they don't have transportation, but the hospital has a system where they could get transportation back to their primary care doctor or for their medical visits. Maybe they can get pharmacy delivery. Maybe they need to know where a food bank is. And so The first start is collecting the data like we just talked about. Now you have to reach back out and start to connect those outpatient support systems. And I think one of the things I've seen in the team model is that it really stresses handing care back to the primary care doctor. And so relating that pieces of information, connecting with that primary care doctor's office before the patient is discharged and saying, hey, we found that they have food insecurity. Is there a place? Is there a food bank? Are you connected to any other social support services in the community that they might be able to use? Or do you know if there's a neighbor who could help take them to their appointment? Yes, we're going to send in home health and physical therapy and those kind of things. And certainly that plays into it. There are eyes in the home. So it's about setting the patient up for success when they get discharged back in that community. So you work with all the parties, the health system, the PCP, maybe home health, and community services to really cast a net around that patient, a support net, and make sure that they have what they need to be successful. So collecting that data is a real first start. We did not do that before from a skilled nursing facility perspective. Now we have to act on that data. And so here's another place where the health system and the skilled nursing facility can work together is understanding from this health system, these are the support services we have, but here's what we work with in the community. Here's what we would suggest that you contact as the patient's ready for discharge so that each nursing facility doesn't have to go out on their own and find every resource that's out there. That's very important to connect those resources.
Absolutely. Well, I love this because I think this is what the patients expect, and to be frank, is what they deserve, is having that shared governance and support of the patient throughout the entire process. And really, I love what you described. It's moving from that sick care system, which we know exists today, to a real healthcare system that supports the patient throughout. So Phyllis, this was awesome. I loved learning about the team model and of course real-time medical systems efforts to kind of bridge that gap between post-acute care and acute care. So thanks so much for taking time to talk with me, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks, Phyllis.
Thanks, John.